Welcome to Stormontville's HealthWise TV, featuring interviews with area experts on health and wellness topics, and a low-impact exercise segment. HealthWise TV is produced by Stormontville Health and is made possible by the following local sponsors. AAA protects one of your most valued assets, your car, with everything from roadside assistance to insurance and trip planning. At AAA Kansas, we help keep seniors safe, mobile, and driving as long as safely possible through our traffic safety programs. Visit www.seniordriving.aaa.com. Aldersgate Village is a nonprofit continuing care retirement community with independent living, assisted living, long-term health care, and memory care, including Alzheimer's and dementia care neighborhoods. Our recovery center is for inpatient and outpatient physical rehabilitation. Contact our marketing office today for a tour. Caregivers Home Health and Caregivers Home Care, your locally owned and managed home health and private duty home care agencies. Whether you need Medicare certified nursing and therapy services or more routine home support services, one of our state licensed agencies will work to keep you safe and healthy in your own home. Jayhawk Pharmacy and Patient Supply, your locally owned and nationally recognized pharmacy and medical equipment provider, serving Topeka and the surrounding communities for over 60 years. Midland Care is a local not-for-profit organization offering hospice care, palliative care, PACE, a program of all-inclusive care for the elderly, home health, Thrive at Home, assisted living, and community grief counseling. Since 1978, Midland Care has touched lives through a range of healthcare services. Topeka Ear, Nose, and Throat. Breathe easy. We're on the case. Visit us at www.topekaent.com.
Welcome in again to HealthWise, the TV show. I'm your host, Ralph Hipp, and Mike Conlin, who was with us recently, rejoins us today on HealthWise TV. We're talking more with Mike about how seniors and caregivers can overcome some of the barriers of staying in their own homes, particularly after a hospitalization or other changes in their health status. One of those barriers, Mike says, can be making sense of your prescriptions. So let's talk to Mike Conlin of Jayhawk Pharmacy and Patient Supply about that right now. Mike, good to have you back again.
Thank you for having me.
All right, pleasure to see you again. Carrying on, continuing on with, we had just gotten together before and back again today. What are some of the medication barriers that patients may face?
You know, healthcare has changed so much now. It used to be you could just have your doctor prescribe a prescription out of the hospital. You'd go to the pharmacy and get your medication.
From the hospital bed to the pharmacy, out the door to the car and go home.
To the pharmacy and go home.
It's more complicated than that now.
So much more complicated now. There's issues with reimbursement, with prior authorizations of medications, whether or not the insurance company will allow you to have a particular medication prior to trying a different medicine. So all those things lead up to just anticipating your departure from the hospital early.
Right. Why do you suppose it has become so complicated? Because in many cases they need to start these scripts right away after hospitalization.
You know, that's a very good question, because oftentimes we'll be on a medication for several days before we leave the hospital. So what we're trying to accomplish is help with that transition of care from the hospital to the home and not making picking up prescriptions a barrier.
Right. And this web, this complicated web of what medications do I go off of or go on to, and my hospitalization, how am I feeling? There's got to be a situation with the availability of medications, and talk some about that, Mike.
Well, you could simply say that not every pharmacy carries every particular medication that is available. It's physically impossible. And there's cost constraints with that, with the pharmacies as well. So, for example, if you're in a smaller town in a more rural community and you've discharged from Stormontville Hospital here in Topeka to another destination, your hometown pharmacy, they may not have what you need. And it's interesting, 40% of the medications that are prescribed upon departure from a hospital are only filled on the first days, 40% on the first day. It takes 9 days for the other 40% of the medications to be filled. And about 10% of the medications, people just, 10 to 20% people don't even have the prescription filled.
They just ignore it?
They just ignore it for a lot of different reasons, which loops back to that whole discussion about availability, financial constraints, and things of that order.
Mike, fill in the blank for me. We're completely out of blank. What would you hear more commonly about that? You know, we just don't have any of that in stock.
You know, that's so painful as a pharmacist. And I've been a pharmacist for almost 40 years now, and it's unfortunate, but there's so many medications available now. They're so sophisticated and complicated, and that's a terrible situation to be in as a pharmacist when you don't have something available for a patient that you're very fond of.
Are there one or two that most pharmacists would normally be out of?
You know, I'd say probably the anti-rejection medications would be an example.
There you go.
That would be a very good
line.
example.
Right.
Some of the cardiac medications, simply because they're not often prescribed. And we want fresh medication to give to our folks.
Talk about the financial side of it, Mike. They're going to be facing those, in most cases, those staggering hospital bills for the stay that they had, depending how long that was. And there's the financial side of how do I pay for these medications. Some of them are fairly affordable, and many of them are not. What do they do financially to get what they need?
Well, that's the difficulty, and oftentimes, and it's just the nature of being a pharmacist, but we don't determine the prices of medications. That's all determined during the decision making when you buy insurance, when you purchase insurance, whatever it may be. So simply put is that if your insurance company says that it's $150 or $200 copay, there's nothing we can do other than work on your behalf prior to your discharge and try and get you something less expensive.
Well, boy, when it comes to any questions of medications and pharmacy, this is the man, Mike Conlin of Jayhawk Pharmacy and Patient Supply on HealthWise show. And one crucial factor, you've talked about the medicinal side of this equation, Mike, but how can caregivers continue to be working or be better as advocates to have the patient get what the doctors in the hospital intended for them to get? What is our role as caregivers?
You know, that advocacy really begins during the hospitalization stay, a conversation with the discharge planner or the case manager as to when do we anticipate going home, what are our needs going to be. You know, use a simple example, a walker, a wheelchair, a cane. You can use that same analogy with medications and anticipate, and therefore you don't have that confusion and anxiety.
And the caregiver's role in saying, or mom or dad, I don't think you should ignore getting this prescription filled, something you'd mentioned earlier.
And that
How can they
happens.
advocate on behalf of that?
Well, you were in the hospital for a reason. You were there because you were ill, and let's don't be readmitted simply because we ignored a medication.
That's a pretty good argument there.
Oh, very,
so use that.
very good.
So, Mike, as we conclude here, we're going to get some exercise in a couple of minutes here, but what are some of the other things you want to say about being an advocate, working with the pharmacists and having the pharmacists and doctors' requests and orders carried out to make sure your mom or dad is okay?
You know, it's having that relationship with your pharmacist, having that relationship with your physician, be it your physician in the hospital or the case manager or discharge planner, creating the dialogue so that we know what we need, so we're going to anticipate instead of react, both medications and medical equipment.
And depending on what your pharmacy is, or if you've known Mike Conlin for years, if they want to get in touch with you at Jayhawk Pharmacy and Patient Supply.
Yes, sir.
We've also talked about some of the patient supply part of this with you on the shows. How can they reach you? How can they find you, Mike?
Obviously, jayhawkpharmacy.com or 785-235-9700 here in Topeka.
Okay. And just a quick thought about reading the directions. That's also one more thing we want to, read those foldouts that are in those prescriptions.
Well, and listen to your pharmacist. Oftentimes it's become a commodity where
Ask
you go.
questions.
Ask questions. When you go through the drive-thru, you're not picking up an ice cream cone. You're picking up very, very important medication.
Right.
You need to listen attentively and ask questions.
Okay. Mike, thank you very much
Thank
as
you,
always,
Ralph.
as we talk about the barriers to the medications you need after hospitalization, getting you back on your feet literally, and making sure that when you're back home, we hope that you're back home and feeling well, that you get those medications that you need. Mike, we'll see you again later on.
Thank you, sir.
Next season. We're about to enter season 2 of the renewed show here, and that's awesome.
Good.
We'll see you then. All right.
Thank you.
Time now for our HealthWise TV exercise segment with our fun and invigorating low-impact exercises. And be sure to consult your doctor. Ask questions before you start this or any exercise program.